Welcome to Zen Zone Health. Today, we're diving deep into a topic that's close to my heart: the early signs and symptoms of colon cancer. You see, folks, knowledge is power. And when it comes to our health, being informed can make all the difference. Early detection is the absolute key to improving survival rates for colon cancer. So, let's equip ourselves with the knowledge to spot these warning signs early on. Let's dive in. Now let's talk about something that can be a bit uncomfortable to discuss, but trust me, it's crucial. It's a topic that many people shy away from, but it's one that could potentially save your life. Rectal bleeding is one of the most common early signs of colon cancer. It's a symptom that can easily be overlooked or misinterpreted, but it's important to pay attention to it. This bleeding isn't always a gushing, dramatic thing. In fact, it can be so subtle that you might not even notice it at first. It can be subtle, just a little bit of bright red blood on the toilet paper or in the toilet bowl. This kind of bleeding is often mistaken for something less serious, like hemorrhoids. Sometimes it might be darker, almost maroon in color, mixed in with your stool. This darker blood can be a sign that the bleeding is coming from higher up in the colon.
Now, look, I know it's easy to brush this off as hemorrhoids, but please, don't. Hemorrhoids are common, but they aren't the only cause of rectal bleeding. Any sign of rectal bleeding needs to be checked out by a doctor. It's not something you should ignore or try to diagnose on your own. It's always better to be safe than sorry, right? A simple checkup can provide peace of mind and, if necessary, catch something early when it's most treatable. Early detection is everything when it comes to colon cancer. The earlier it's caught, the better the chances of successful treatment. So, don't hesitate. If you notice any signs of rectal bleeding, make an appointment with your doctor right away. Your health is worth it.
We're going to get up close and personal with our bowel movements for a moment. I know, not the most glamorous topic, but stick with me. Have you noticed a change in the shape of your stool lately? Specifically, has it become consistently narrower than usual, like a pencil-thin appearance? This, my friends, can be a red flag. A tumor in the colon can actually narrow the passageway, making it difficult for stool to pass through. Now, I'm not saying every change in stool shape is a sign of cancer. But if you notice a persistent change, especially if it's accompanied by other symptoms we're discussing, please don't ignore it. Make an appointment with your doctor and get checked out. Let's talk about a feeling we've all experienced at some point. That urgent need to go to the bathroom. But when you get there, nothing happens. Frustrating, right? You rush in, expecting relief, but instead, you're left sitting there, puzzled and uncomfortable. It's a common scenario that can leave you feeling quite uneasy. Now, if this happens occasionally, it's usually not a big deal. Most of us have had those moments where our body just doesn't cooperate. Maybe it's stress, maybe it's something you ate, or maybe it's just one of those days. You shrug it off and life goes on. But if you're experiencing this frequently along with a feeling of incomplete evacuation, it's time to pay attention. Imagine having to visit the bathroom multiple times a day, each time feeling like you haven't fully emptied your bowels. It can be quite distressing and can significantly impact your daily life. This is called tenesmus, and it can be a sign of something more serious like colon cancer. Tenesmus is that persistent feeling that you need to have a bowel movement, even if you've just gone. It's not just an inconvenience, it's a symptom that shouldn't be ignored.
Imagine a tumor in your colon, partially blocking the passage. This blockage can make it difficult for stool to pass through, leading to that constant urge to go. It's like a roadblock in your digestive system. It's like trying to squeeze a large object through a small opening. The pressure builds up, but nothing can move through easily. This can cause discomfort, pain, and that frustrating feeling of incomplete evacuation. So, if you're feeling that constant urge to go, but nothing's happening, or you feel like you can't fully empty your bowels, please don't ignore it. These symptoms are your body's way of telling you that something might be wrong. Get it checked out by a medical professional. Early detection is key in managing and treating conditions like colon cancer. Don't let embarrassment or fear stop you from seeking help. Your health is too important to ignore.
Okay, let's talk about constipation. We've all been there, right? It's uncomfortable, it's annoying, but it's usually not a major medical concern. However, if you're experiencing persistent constipation that just won't budge, even with dietary changes and over-the-counter remedies, it's time to dig a little deeper.
You see, a tumour in the colon can actually obstruct the passage of stool, leading to constipation. So, if you're dealing with constipation that's out of the ordinary for you and it's been going on for a while, don't just suffer in silence. Talk to your doctor. They can help determine the underlying cause and get you back on track.
Our stomachs, they talk to us, right? And sometimes they're trying to tell us something important. Frequent abdominal pain, especially if it's a cramping type of pain, is something you should never ignore.
Now, I'm not talking about the occasional tummy ache after a spicy meal. I'm talking about persistent pain, especially if it's accompanied by other symptoms like bloating, nausea, vomiting, or changes in your bowel habits. This type of pain can be a sign that something's not right in your colon.
A tumor can cause blockages, leading to these uncomfortable symptoms. So, if you're experiencing persistent abdominal pain, don't just pop a painkiller and hope for the best. Get it checked out by a medical professional. Unexpected weight loss. When dropping pounds isn't a good thing, we all love it when our clothes fit a little looser, right? But sudden, unexplained weight loss is never a good thing.
If you're noticing the pounds dropping without any effort on your part, especially if it's accompanied by other symptoms like changes in bowel habits, abdominal pain, or fatigue, it's time to see your doctor.
Colon cancer can sometimes cause weight loss because the tumor affects your body's ability to absorb nutrients properly. So, while weight loss might seem like a positive thing on the surface, it's crucial to pay attention to your body and seek medical advice if something feels off. Chronic fatigue. Beyond just being tired. We live in a fast-paced world, and it's easy to feel tired, right? The hustle and bustle of daily life can wear anyone down. From long work hours to endless commutes, it's no wonder we often feel drained. But there's a difference between everyday fatigue and chronic fatigue that just doesn't quit. Everyday fatigue can usually be remedied with a good night's sleep or a relaxing weekend. However, chronic fatigue is a different beast altogether.
If you're constantly feeling exhausted, even after a good night's sleep, and you find it hard to get out of bed in the morning, it might be more than just being tired. And this fatigue is lingering for weeks or even months. It's not something to ignore. Chronic fatigue can creep up on you, making each day feel like a struggle. It's time to listen to your body. Pay attention to the signals it's sending you. Persistent fatigue is your body's way of telling you that something might be wrong.
Chronic fatigue can be a sign of many things, including serious conditions like colon cancer. It's not just about feeling tired, it's about understanding the underlying causes. Sometimes blood loss from the tumor can lead to anemia, which can make you feel constantly drained. Anemia reduces the number of red blood cells, which are crucial for carrying oxygen throughout your body.
So, if you're experiencing persistent fatigue that's impacting your daily life, don't just brush it off as stress or overwork. Chronic fatigue can affect your ability to perform daily tasks, enjoy activities, and even impact your mental health. Talk to your doctor and get to the bottom of it. Early detection and treatment can make a significant difference. Your health is too important to ignore. Take action and seek medical advice to ensure you're not overlooking a serious condition.
Nausea and vomiting, more than just an upset stomach? We've all experienced nausea and vomiting at some point, usually due to a stomach bug or something we ate. But what if these symptoms persist and you can't seem to shake them? Persistent nausea, especially when accompanied by vomiting, can be a sign of something more serious, including colon cancer. A tumor in the colon can sometimes obstruct the digestive tract, leading to these uncomfortable symptoms. So, if you're experiencing frequent nausea and vomiting that's unusual for you, don't just reach for the antacids. Make an appointment with your doctor to rule out any underlying medical conditions. Stay aware, stay healthy. Thank you for joining me today on Zen Zone Health. Remember, early detection is our greatest weapon in the fight against colon cancer. Pay attention to your body, be aware of these signs, and don't hesitate to reach out to your healthcare provider if something feels off. Keep track of any changes in your bowel habits, stool shape, weight, and overall health. And remember, knowledge is power. Don't forget to like, share, and subscribe to our channel for more health tips and information. Stay healthy and stay informed.